Hey everyone, in this week's Braces video I want to talk to you about NHS Dental Treatment. On the NHS you have 3 bands of dental treatment, band 1, band 2 and band 3. I will go into more detail about them in a minute, but basically the band depends upon what kind of treatment that you need in order to make sure that your gums and your teeth stay healthy. If you're not exempt from these charges, which I'll go into list later on in the video of people who are, then you'll be asked to pay one of these bands once for the complete treatment that you go through. You don't have to pay every time you go. If you start a treatment for, say, a filling and it takes more than one appointment, you pay that one band price. You do not pay it more than once. Let's start with band 1. Band 1 costs £18.50 as of the 1st of April this year, and it is everything from the diagnosis to helping maintain your teeth, giving guidance for what you're going to need to be healthy. It has things like polishing and cleaning up your teeth and making them look nice. So that's like the first band, and it is the cheapest and also the probably easiest procedures involved within that band. Band 2. Band 2 costs £50.50, which is quite a bit more compared to band 1, but it covers absolutely everything you get in band 1, and also things like root canals and having teeth out and also having fillings. And finally band 3. Band 3 costs £219 for the treatment. That's way out there, and that covers everything that is in band 1, band 2, and it also covers things like bridges and crowns and dentures. Now for all the lovely people who are exempt from paying NHS charges, which includes me at the moment. You do not have to pay for NHS dental treatment if when the treatment starts you are aged under 18, under 19 and receiving full-time education, pregnant or a mother who's had a baby in the last 12 months, staying in an NHS hospital and your treatment is carried out by the hospital dentist, an NHS hospital dental service outpatient. However, you may have to pay for dentures or bridges. You also don't have to pay if at the beginning of the treatment you are included in the ward of income support, receiving income related employment and support allowance, receiving income based job seekers allowance, receiving pension credit, receiving universal credit, check entitlement after the 31st of October 2014. You are named on a valid NHS tax credit exemption certificate, or you're entitled to one. And finally, you are named on a valid HC2 certificate. I'll include a link to the NHS page that allows you to see the full list of things that would make you exempt to paying their charges, which is quite a long list, but you have to be within specific areas to fit within that, and if you're not, I'm really sorry, you have to pay all the money, and I will be very soon. So that's the end of the video. This one's been more of an information giving video, and I hope that it will help you in understanding dental treatments and trying to pay for NHS or trying to avoid paying for it. And I will see you next week.